Welcome to Motherhood. I'm Dr. Christina Hibbert, and I'm here to help you overcome, to become, and to flourish in this sometimes painful experience we call motherhood. And today we're going to be talking about some of those painful, difficult times in our life. In fact, we're going to be talking about trauma. And you might be listening and thinking, well, I don't know if I've ever experienced trauma. You might be thinking, I definitely have experienced a lot of trauma in my life. Either way, I hope you'll stick around because all the things we talk about today can apply for you, for your children, for those in your life who do go through trauma. And you might just find that some of the things you've been through could be classified as traumatic, even if you haven't yet identified that. So stick around. We have a special guest, Guy McPherson here, who does the Trauma Therapist podcast and website as well. He is a wealth of information, and just stick around so that you don't miss it. Now, I just want to thank you for tuning in each week here on Motherhood, and thank you for joining us on my website at drchristinahibbert.com and on our Facebook group, which is Growing Through Motherhood. So if you haven't been added yet, just ask to be added, and we'd love to have you there as well. Also, you can find us all over social media, so check us out on Instagram, Pinterest, Twitter, and of course on YouTube, where you can find a video of today's episode. Now, as I mentioned, we're going to be talking about trauma, and I was thinking about trauma in my own life and with my clients and thinking about how did I get into this whole area of working with trauma and grief and loss. I think I started by working with grief and loss because, as many of you know, my little sister died when she was 8 and I was 18. And I knew that was definitely a major loss in our life, and I had a lot of grief, and I felt like I wanted to help other people because I felt like I understood something that other people maybe didn't understand yet, death and that grief process. But it wasn't until I lost my other sister and brother-in-law back in 2007 that I realized that I really was experiencing trauma this time. So the way that my sister died, because she died so suddenly and by her own hand, by taking too much Tylenol and alcohol, the way that she died and having the police find her and call and tell us that, they wouldn't tell us actually over the phone, but telling my mom she just needed to go over there, and the way that it all happened, and then inheriting those two children, our two nephews who are now our sons, all of that combined, I didn't realize till many months after, was traumatic. And it's now that I say it, it's like, well, of course it was traumatic. But I remember being in therapy for several months and going through, the grief process actively. I wanted to go through it. I knew that I needed to. I knew what to do. I'd been through grief many times, and I was jumping in. But I remember one day sitting there and feeling like this grief isn't going away and it's not getting better like I thought it would, and it's taking so much longer than I thought it would. And of course, I knew that, everybody else in the family had to heal as well. But I remember saying to my therapist, I think I've been traumatized. Have I been traumatized? And he kind of was like, yeah, you've definitely been traumatized. This has been traumatic. And that was the first time that I really identified that, oh, yeah, I guess this is a trauma. So even if it's not some kind of violence against you or some kind of, where you feel like you're about to die, trauma can take many forms. And that's the first time I really realized that in my own life. And then a few years later, when my dear friend took her life, that was another trauma. She left her daughter at my house and she jumped off the Grand Canyon. And we were there with her family when they found out. We were there with them through the whole process of trying to help them pull back together and dealing with the police and everything else. And to me, immediately I knew this is traumatic. This is traumatic for all of us, for my kids again, for me, for all of us. And, it's just a whole different level of grief and loss when we're talking about trauma. And I think it's important for us to realize that in motherhood, we're going to experience a lot of traumas. You might not have been through a scary death of a loved one or the perceived death of yourself or the things I've been talking about, but there is such a thing as birth trauma. In fact, about 25 to 34% of women say that their birth was traumatic, where they thought that the baby was going to die or something was going to happen to them or the baby or something was happening. And again, it's your perception of that. So we have birth trauma. Obviously, our children can be traumatized. I have several friends who have had the unfortunate experience of having their children, molested or abused or taken advantage of by a babysitter or things like that. That is traumatic. So there are so many different ways that we can experience trauma we're going to be talking about today. And I think it's really an important topic for motherhood because of our role as being, the caretaker of our family. And if we have our own trauma, we need to deal with it. And then we also need to know how to help those around us. So let me introduce our guest who is nodding along nicely as I'm talking here. Guy McPherson, welcome to the show.
Thank you so much. I really appreciate you inviting me to be here and just listening to your story. I mean, it's riveting. I've heard it before, and so many things come up for me as you're telling that story. And I think the fact that you're taking the time to talk about this story here within the context of being mothers. I mean, as you use that word, it's mother just seems like at the core, at the nexus of the family.
Mm-hmm.
But obviously, again, you're human beings, and as human beings and as women, there's we all are very close, whether we know it or not, to trauma. I mean, in terms of proximity, people we've known, et cetera, et cetera. So,
right.
yeah.
And I really appreciate that. Guy let me tell you a little bit about Guy because he has done so much work around this and interviewed so many amazing people on his show, which is the Trauma Therapist podcast. Sorry about that. And that's how I got to know him. He invited me to be on the show as well. So you can check out my interview with him on his show as well. But first of all, Guy is a husband and a father of two. So he does understand what we're talking about here today. He's also a psychologist who specializes in the treatment of trauma and early psychosis. His website, before I forget to mention, is thetraumatherapistproject.com. And he founded this website, the Trauma Therapist Project, with goals of raising the awareness of trauma and helping other trauma therapists like myself learn about trauma-informed treatments and to help them give better treatment. And he started this back in 2014. And then shortly after, he started the Trauma Therapist podcast with little to no experience, but it's now being listened to in over 120 countries around the world. And he also created Trauma Therapist 2.0, which is an online membership community dedicated to educating, supporting, and inspiring new trauma therapists. So again, a wealth of information here. Guy, we're so lucky to have you.
I appreciate that. That introduction sounds pretty good.
Okay, I know. It's nice when you get a nice introduction, right? Well, let's jump right in. So first of all, help us define what trauma means. Because as I was saying at the beginning, I think some people might hear that, even I did for a while, and think, well, I haven't experienced trauma, right?
Yeah, I mean, and I think it's really important to be cognizant of the language we're using, because when we say, "Oh, that's traumatic," I mean, we just throw that around in our common parlance every day. But when we're talking about a clinical diagnosis, when we're talking about trauma, we're talking about really something. And again, I'm going to refer back to what you said. Um, you know, our lives are changed. Our what we consider to be our normal has shifted. Our paradigms of what we consider comfortable has shifted. Meaning, what is going on here has shifted. Oftentimes, we talk about trauma. We talk about combat trauma. People are really familiar with that, or automotive accidents, things like this. In one sense, there are those experiences that are life-threatening, where, again, we are wondering whether or not we're going to live or not. If someone gets into an accident, oftentimes that becomes very traumatic. Not everyone experiences the effects of that. Not everyone is going to experience PTSD, and I think that's really post-traumatic stress disorder. I think that's really important to point out too. Again, as you pointed out, it's how we perceive that, and we can talk about how that's developed and so forth. But when we're talking about the definitions of trauma, there's oftentimes it can be abuse, it can be molestation, it can be sexual assault, rape. It can be combat trauma. It can be, um, they oftentimes they kind of separate into man-made or kind of natural disasters. If people go through natural disasters, those can be oftentimes really traumatic.
Mm-hmm.
And then there's another kind of uh, segment which is called kind of complex PTSD, and that's kind of defined by this kind of over a prolonged period of time. So oftentimes we're looking at child abuse that has maybe been experienced over a year or years,
Yeah.
and there's kind of a difference of symptoms there. But again, um, these events, these experiences, this trauma, these traumas impact who we are as human beings.
Yeah.
And it's profound. It's
Yeah.
profound.
It's profound. You're right. And that's why I'm so glad we're talking about this, because I loved what you said just a little while ago about how we're not far away from trauma, no matter where it is, whether it's in ourselves or in somebody we care about. It's unfortunately a big part of our world. And you mentioned many different ways that we can experience trauma. Of course, the ones that we always think about, and then, obviously ones that maybe we don't think about. And then the differentiation between that complex trauma experience or complex PTSD, which, again, to kind of clarify for everybody, is sort of trauma that exists over an extended period of time. So what would you say, what are some of the symptoms, I guess, of trauma, or this more, intense form of trauma with the complex PTSD, so people can kind of understand what they're looking
Right.
at?
And
Mm-hmm.
I think it's a really good question, especially in the context, again, of this particular podcast, because as mothers, it's, oftentimes with complex PTSD, we're looking at kind of abuse, child abuse. I work in a clinic where I take phone calls from parents and teachers, and it's just crazy how prevalent trauma is, abuse is.
Mm-hmm.
But symptoms are, and again, when we're talking about this label of kind of complex PTSD, some of the symptoms are individuals become kind of disoriented. Their levels of consciousness might shift. They might dissociate more or kind of blank out more.
Mm-hmm.
And oftentimes, that's not really easy to spot. That's not easy to see. As a parent, you might notice your kid maybe spending more time in their room and thinking, oh, maybe they're tired, or maybe they're actually depressed, which could be another symptom of complex PTSD. Um, the way individuals kind of respond and relate to elders. Okay, if there's a shift in how that is, or the way you're noticing that as a parent,
Mm-hmm.
that could also be a sign. Again, each one of these things, each one of these symptoms taken apart doesn't couldn't mean much at all. It could just mean, little Billy's tired or little Sarah's, you know, needs to rest before her exam.
Yeah.
But again, this is something as parents we have to begin to ask questions, and that's another, great topic that we can look at too.
Yeah, and you're bringing up something really important, because obviously we can talk about how we ourselves as mothers experience trauma, but with our children, it can be tough. It's hard enough for us to identify maybe when something has become that traumatic experience versus, knowing with our kids what's going on. Some things are obvious. That your child's been abused or that they've been in an accident or something traumatic. I was just actually thinking while you were talking, I was thinking, gosh, here I am at the whole beginning talking about my traumatic experience. Well, my two little nephews, who are my sons now, they found their mother dead in her bed in the morning and called the police. And I knew that they were traumatized. Like, that was a no-brainer to me. But helping them deal with the trauma, that's a whole other level. I didn't even mention that. So it really can be a challenge. I'm glad you're pointing this out. So let's kind of back up a little bit and talk about, like, normal trauma, how let's say that a mother's child, who's listening, their child has experienced a trauma, but the mom doesn't know about it, let's say, but they're exhibiting symptoms of sort of a normal response to trauma. What would a normal, quote unquote, response to trauma look like, would you say?
Okay, well, I think if we're talking about what type of trauma, let's talk about bullying. I mean,
Yeah.
that can be very traumatic too, and I can
Yes.
speak from that from a personal perspective. But
Mm-hmm.
again, what we need to look for, and I say need to look for as parents, is shifts in behavior.
Mm-hmm.
Number one, and number two, asking questions. And again, here we have to be very careful about our language. For example, if I'm asking my son, has anyone done anything to you that was traumatic? Obviously that's kind of an extreme. He's not necessarily going to know what traumatic is,
Right.
but can we talk about safety? Was there, when you went over to your friend's house, how safe did you feel? For example, if you're sending your son or daughter over to someone's house where there's a babysitter, maybe you trust that babysitter, right, at a friend's house, but putting in terms of safety, was there anything that happened that you didn't like, that didn't feel comfortable for you? When we use this kind of language, we can kind of get a gauge of shifts in our children's behavior or responses. That's really a kind of a telltale sign there.
Mm-hmm. So obviously we talk a lot about that on the show, about keeping their communication open and trying to talk to kids in a way that they'll understand. So that's a really important key for us to understand what might be going on in their life when we don't know.
Right.
And how do we know? Let's say, okay, so let me ask you this. We're kind of getting a little off of our outline here, but it's good. This is good stuff. That I think the moms want to know about is, so if we know that our child has been through what we would perceive as a traumatic experience, how do we know if they're, exhibiting symptoms of sort of having a response to that, let's say?
Okay, well, that's a great question. I think it's going to be important to talk about what type of trauma. I mean, have they
Yes.
been in a car accident, or did they witness a car
Yeah,
accident?
let's say something that they see or experience like that. Let's do that. So it's not physical, because obviously
Okay.
physical has a whole different other set of. So let's talk about that. An emotional trauma. I mean, just, yeah.
Yeah, again, if there we could be looking for changes in behavior. We can looking for shifts in their patterns. And again, if we're if what's going to determine if this is PTSD is if this goes on before or over a longer period of time. Where acute
Yeah.
PTSD happens within that 1 month period,
Mm-hmm.
and a lot of times everyone is going to have a particular reaction to that or response to that. But
Yeah.
when it starts to go beyond that 3 months, 6 months, then we're looking at post-traumatic stress disorder as a clinical diagnosis here.
Right.
And again, depression, shifts in behavior, isolation. Are they having trouble sleeping? Are they having trouble eating? Are they becoming angry? Are they getting depressed? Again, these could be indicators that they're having a normal, healthy response,
Mm-hmm.
or if we're going over that 30-day period. And again, this is not always black and white, but
Yeah.
then that might be more indicative that there's something going on. But again, we're lucky as a parent if we know that event has happened, then we can kind of set that magnifying glass on them, if you will, and that spotlight on. Oftentimes we
Right.
don't know. With the
Yeah.
case of bullying,
Yeah.
that's a classic example. But
Right. No, and I'm glad you brought that up because it's so prevalent and it's an emotional trauma. I was just reading a friend's book it's coming out soon, and she was talking about how, she remembered she was hit by a car in high school, and she had to go to the hospital, and she broke all these bones and all these things happened. And then, around the same time, somebody said something horrible to her and about her, and everybody believed it, and they were throwing things at her, and they were calling her names. And she said, I can't remember the physical pain of that accident, but the second I think about that emotional pain, it's all right back. So when we're talking about trauma today, we're not just talking about you've been in some kind of physical accident or experience, but rather it's that emotional reaction to whatever you've been through, whether it be physical or not, that really constitutes that trauma response, would you say?
Yeah, I would completely agree with that. And I think, again, if we're speaking from the perspective of parents or mothers,
Mm-hmm.
it's really important to honor that and to
Yeah.
honor the fact that, uh, just because we didn't experience, we might share an event with our son or daughter or partner for that matter and not be traumatized. That does not mean that that other person is not going to be traumatized as well.
Yeah.
That's a big piece of it. Piece of this is understanding that each of us will kind of may perceive things very differently.
Right. It's truly relative, and it's all about your perception of the event that happened. And that's
Right.
by definition what PTSD is all about. It's doesn't have to be that anybody else thinks it was traumatic, but you perceived it as a traumatic event.
Exactly.
Yeah.
Exactly.
So, okay, so we've been talking a little bit about how to recognize this in our children, and obviously I'm thinking the same things that you're saying apply to us personally as well. And I'm thinking of all kinds of examples of trauma that we as moms can experience as well. Like we talked about some like birth trauma and, different kinds of life events that happen. But also, I'm sure there are some mothers listening who experienced, abuse as children or have been through sexual abuse or violence, domestic violence. These kinds of things are also traumas that we can experience. And so would you say that moms can expect the same kind of reaction if it's their personal feelings, and how would they identify them in themselves, I guess?
Yeah, another great question and a big one too. And I think what's really important to point out there is it depends when that abuse took place. For
Yeah.
example, if that abuse took place very early on, oftentimes that becomes that person's kind of model, that person's
Yeah.
paradigm about what is real, what is right, what is normal. And that can often uh, shift the trajectory of their lives,
Mm-hmm.
and how they relate to people, such that no, I haven't been traumatized. They don't know it. They don't realize it until maybe they get into a relationship and things fall
Yeah.
apart, or they get into another relationship and they find that they're in a pattern where they're kind of courting unwittingly these types of people. So that becomes very tricky because oftentimes either the identification has to come from an outside source, or for lack of a better word, kind of hitting rock bottom where something's wrong and that person might go to therapy
Mm-hmm.
and things might kind of unfold that way.
Right. So can you think of a story or example of that we might share to kind of illustrate this point of, yeah, how it pops up
Yeah.
later?
Well, yeah. I mean, I work with individuals between the ages of 12 and 25,
Mm-hmm.
most of whom have experienced trauma of various kinds. Actually, most of whom have suffered from abuse.
Mm-hmm.
And I can think of a particular example with this one client where, in the beginning, this particular client didn't want to talk about their father. I don't want to
Mm-hmm.
talk about it. I don't need to, blah, blah, blah. And over the course of several months, things began to unfold, and it became clear that not only was this person traumatized or physically abused, but because that had been their reality, it was nothing. That's just the way people were.
Yeah.
Doesn't every father do this?
Mm.
And it took, see, so many things are coming into play here. The rapport that has to be built with the therapist. Oftentimes
Mm-hmm.
people aren't coming into the to the office, just laying it out. Sometimes they are, but sometimes they come in because they're feeling depressed or they're feeling anxious, and these things unfold.
Right.
And
True.
there's this whole other topic to this, which is shame.
Mm-hmm.
I've been traumatized, I've been abused, I've been bullied. I'm a male and I've been bullied,
Mm-hmm.
you know. So language here is very important.
Mm-hmm. Yeah.
Stigma is very important too, being aware of that.
Right, because you're right. And the
So,
shame, I'm so glad you brought that up. That's such a huge part of it too, feeling ashamed for what happened or taking on that blame of what happened, that you somehow caused this trauma to happen, especially when we're talking about abuse in any way, shape, or form, or bullying even.
right,
Yeah,
right.
that's huge.
I want to come back to your question because I think it was a very important one. Is
Yeah.
how people, women can even realize this is, I think, being open to questioning themselves about, knowing if there's an event has happened, oftentimes questioning themselves, looking at how they're behaving. And again, this, stigma comes in. Sometimes you don't want to look at that.
Yeah.
We're talking about very events here, which people have to be willing to kind of open that door and say, you know what, I need help.
Yeah.
So
Yeah.
something's not right.
Yeah. And that's the hard part is you're right. I mean, we understand why you might not want to open those doors because it is painful. And I work with, a lot of adult women, and I'm thinking of a client in particular who, was just going along great in life. And she has bipolar disorder. She was on her medications and doing everything well. And she, for whatever reason, probably because she was in a manic episode, stopped taking the medication, and it completely, and they didn't know, nobody knew for a couple of weeks. She didn't even realize herself what she'd done. And, it set off this huge earthquake in their life. And as we started doing therapy to try to help her get back into this healthy place and overcome the depression that she was now in, we started talking more about her family life growing up, of course. And she kind of was like, you know what? It wasn't great, but it wasn't awful. But when we really talked about it, it was awful to me. And I had to say to her, this is awful. This is traumatic. I mean, her mother told her to tell her father that they were getting a divorce. She just left one day and was like, go tell your dad that I'm divorcing him. And she left, just all kinds of things where she was not emotionally allowed to have any kind of feelings. She wasn't allowed to. Nobody took care of her. Nobody was there for her. And so she learned to sort of stuff all her feelings and not deal with it. So, but to me, when I hear it, it was like, well, this is traumatic, these things that happen. But because it wasn't physical abuse or whatever, she didn't identify it that way. And it didn't come out until all these years later. And I think that happens all the time, that we just don't see it for what it is, or we think we've closed the door on that. We don't want to open it back up. We don't realize it's really underlying all these other things that are going on in our life right now.
Yeah, yeah. I mean, you don't need me for this episode. You're saying everything that is right on the money here. I think that bit about not seeing it for what it is.
Yeah.
If was there a broken bone? No. Was there any blood loss? No. You're fine.
Mm-hmm.
That can be very damaging.
Mm-hmm.
And again, it's really important here to. One of the things that I wanted to point out is, if someone has experienced an event in their life that they know was traumatic, and maybe they don't feel that, they've been traumatized, I'm fine. One of the indicators might be, I'm not saying it's definitive, but it might be kind of dysfunctional patterns, oftentimes in relationship, dysfunctional patterns in, maybe people are physical ailments. That might be an indication. So, yeah, this topic is a really tough one, but I think one of the most important things that I would like to kind of impart here, Christina, is that there is hope, that you can get better for whatever it is. And oftentimes people are like, there's no way that I could ever forget that. And you're probably right. You won't forget that, right? We're not saying that you're going to forget it, but shifting how it's impacting your life is very important. Knowing that things can shift so that you can lead a healthier life is very important. Because oftentimes when people have gone through that, as you know, there's no way out, right?
Right. No. And I'm so glad you said that, because that's what I want us to do, is kind of shift now. We've talked a lot about what trauma is and how you can identify it and how we can identify it in our children. But the bigger question here that we want to talk about is, how do we heal from it and where do we begin? And, your point about there is hope, I think that's a good starting place. So, let's talk a little bit about where to begin when we're talking about healing from trauma.
Well, I think first step is being able to recognize that one, something something happened. B, that maybe I was impacted by it. Kind of that recognition, that having that awareness is crucial. Without that, no one's going to take that first step to get any help. And I think therapy can be really, and that can be had engaged in on many different levels, right? But talking to someone who's equipped to deal with this and manage this and help you kind of guide you along this journey of healing is really, really important.
Yeah.
So that almost seems too much of an easy answer, but it's not. But
That's just the
you know,
beginning.
it's just beginning,
Yeah.
but it's a crucial step.
Yeah, it is.
You have to be willing to say, you know what, I need help.
Yeah. Yeah. And that's why I'm hoping by doing this show that there are listeners out there saying, you know what, I'm recognizing some of the things that Guy's saying here that, I think maybe I have some of these things, or I'm seeing some of these things in my kids. And that's another great tip too, is if you are seeing things and you're not sure, you can go to a therapist and get somebody else involved that can look with a new set of eyes and that has that skill and training to help you identify what's really going on if you're not sure.
Right. And even make a phone call too.
Yeah.
I think, shoot me an email if you're like, you know what, I'm seeing this we get this all the time where I
Mm,
work in this clinic. My son's doing this or my daughter's doing this. Does that mean they've been traumatized? Well, no, not really. But when you take it, in the larger scope of things, and we have to be willing to look at in the larger scope of things and see where this particular symptom falls in the particular puzzle, right? The piece of the puzzle,
mm-hmm.
then we can get a more accurate look. And a lot of times it is,
Yeah.
when there's, yeah.
Yeah. Yeah. And I want to say too that sometimes I'm totally with you. I think it's really important that we identify there's a problem and just start to reach out in whatever way it may be. And you are in Oakland, California, correct?
I'm in Oakland, California, yeah.
So that's where your practice is. So anybody who lives
Uh,
around there.
you can definitely shoot me an email. I mean, I get emails like that all the time.
Yeah.
Um, and I'm definitely willing to help out with that.
Yeah.
And I have another resource that I'll probably shoot you the link for it. One of the
Great.
kind of the master therapist I interviewed, Linda Curran, she has a database. It's a national database of kind of certified trauma therapists.
Oh, great.
And you just click on the state you're in and the city you're in or whatever. But,
Oh, great.
getting that hope for your listeners, there's so much hope out there. You can lead a healthier life. So,
Yeah, I appreciate that. Yeah, send me the link and I'll put it in the description for this episode so that if you are thinking you want to reach out for help, that you can start there. That's great to give everybody a place to start. Now, the other thing that I think, so we're talking about maybe starting some therapy and getting some help that way. And of course, I echo that. I know I'm biased, but therapy is wonderful, especially when you're going through trauma and you're grieving and you're having a hard time. I mean, as I mentioned at the beginning, I've been myself many, many times and taken my children when I've needed extra help. So I'm a huge fan as well. But, I know a lot of the questions that can come that we might have are a lot of the why. Why did this happen? Why did I have to go through this? Why? And, I just wanted to kind of give my 2 cents on that before letting you kind of jump in and start teaching some of the other components of healing or what we might do in therapy, what we might learn. And we're going to talk about Guy's trauma toolbox too as well. But, as I wrote about in my book, This Is How We Grow, that we're all given an abundance of whys in our days. When hard things happen, when we have trauma in our life, we do get stuck on those questions of why, and a lot of them are never going to have answers, so we might sit there forever and be trying to figure out why did this happen, or why am I feeling this way, or why am I not better, when the better question is how, and this goes back to what Guy was saying. It's how can I move forward? How do I heal from this? How can I take what has happened, and even if I don't understand why it's happened, how can I learn from it and heal and have that hope and become well again? And so let's talk about some of the components of healing and some of those hows that we might, that can help us to heal.
Yeah, I think that one of the first things that's important for someone to realize when they begin therapy and begin working with someone who specializes in this is that that therapist will impart hope. Mm-hmm. And again, that's one of the first things that is completely off the board when someone has experienced trauma. They're like, and you were talking about, your whole paradigm shifts of what's real or what's normal. What does this mean? Why has this happened? And in order to begin this healing, we have to believe that we can get better.
Mm-hmm.
And that is crucial at that kind of beginning, what we call kind of the stabilization period of working with the trauma, is knowing that we can get better.
Yeah.
I think as things move forward in the healing process, therapists might introduce you to look at how you have been affected. Have you been impacted in your relationships? Have there been certain triggers that have happened that are kind of created this negative feedback loop with how you're interacting with people repeatedly, for example?
Mm-hmm.
Are there kind of bouts or periods of depression or explosiveness or isolation or numbing? Again, these are kind of classic symptoms of PTSD, but they manifest within our lives in kind of curious ways where we don't maybe think that it's kind of abnormal, but when put in place of what's happened to us when we have been traumatized, we begin to see how dysfunctional these kind of things have impacted us.
Mm-hmm.
But being aware of them, we're able to like look at them and begin to create other or new patterns of behavior, healthier patterns of behavior for ourselves.
Yeah, that's a great way to put it. So not only does finding not just a therapist, but a good therapist and the right therapist for you, right? That's really important. Like you
Exactly.
mentioned rapport earlier. It's really important for everybody listening, if you're going to find a therapist, to not only find someone who specializes in treating trauma, but also that you feel comfortable with and that works in the way that is going to work for you, you feel, right? So,
And that could be a process.
yeah,
Oftentimes that's a process. People
yes.
find someone and like, you know, uh, the fit's not good, and according to them, therapy is awful.
Yeah.
Well, I would encourage them to dial again,
Mm-hmm.
keep there is a therapist out there for you.
Yes, and amen to that, because you're right. It can take more than one try sometimes. Even if someone's highly qualified, if you don't feel comfortable, keep working until you find the right person. And then once you do, you should have that sense of hope that Guy's talking about. I always tell people when they leave the first session, think about how you felt, and you should feel something good. You should feel, hope or some sense of relief, or like you feel like I can help you or something. And if you don't, then we need to either talk about it or we need to help you find somebody else. So that's really important. And then, as you're saying, the therapist can help you weed through how this trauma has impacted your life and how the symptoms that you're experiencing has impacted your life in all these different ways, and then help you to obviously go in and start working on those different areas. So can you give us an example, like what are some examples of how trauma and PTSD might impact all the different areas of our life, like our relationships and our work and school or whatever it may be?
Yeah, well, that's another good question too. And in answering that, I want to bring into the conversation here how trauma impacts us. And a lot of times, oftentimes, people don't realize that trauma is kind of lodged in our bodies.
Mm.
People often think that it's just kind of, in our head, kind of a cognitive episode. But
Mm-hmm.
oftentimes, we're impacted somatically or via our body by kind of symptoms, which can be triggered by individuals or events or places or rituals, for example.
Mm-hmm.
And again, one of the things that a trauma therapist, again, who specializes in this, might work with you, depending on their kind of orientation, is the body,
Mm.
how to be comfortable with your body. And one of the ways that we might be impacted by this, depending again on the type of trauma, is through our relationship, through our physical relationship, through our intimate relationship with our partner.
Mm-hmm.
Oftentimes that becomes affected or impacted, taken to either extreme,
Mm-hmm.
whether it's shut down or it's hyperactive too. This is such a huge topic
Yeah,
here too, but
I
that's such a
know.
great question. How does it play out? What was your
Yeah,
kind of
so
had
let's
how it
talk
plays
about
out?
like relationships, work, and school, or how we
Yeah,
mother. We're talking to moms here. How might it impact that?
I think that's another great question too. It can in terms of how we mother or how we parent, it could impact us I'll give a personal example.
Mm-hmm.
I was bullied when I was at that kind of really formative age of like 10, 11, 12.
Mm-hmm.
And it shifted, Christina, the whole trajectory of my life in terms of power dynamics and how I react in certain situations.
Mm-hmm.
And to answer your question, how can that impact us as a parent? We can become, and I did become, hyper focused on certain things,
Mm-hmm.
hyper focused on the way my son's treated in certain circumstances. So that can be an indication. It's not a closed deal, but it can impact us in that way.
Mm-hmm.
And you can use that example in terms of, if someone's been abused, if someone's been physically abused or sexually abused, that is going to impact their being. In turn, going to impact how they relate to their child. They
Mm-hmm.
might be so overprotective, or to a degree where it's impacting that kid's behavior and or learning.
Right. And on the flip side, some parents might be completely tuned out because of the pain that they carry and not wanting to recognize it or deal with it, right? I mean,
Right,
can
and
go
be
both
and or be
ways
triggered by
or
it.
be triggered by it.
Right.
Yeah. Mm-hmm.
Right. So in terms of if we're a parent and we're not getting our help that we need, we may not be aware of how in turn we're impacting our kids,
Yeah. Yeah.
right? Because we're not aware of what we're doing.
Mm-hmm.
So again, if someone's out there and they're listening and they know that they've something's happened to them, they might not deem it trauma, but maybe they've been abused physically, sexually, or if,
Mm-hmm.
if if they know something's happened. Again, I'm not saying you've definitely been traumatized, but it's worth looking at, questioning yourself, and just maybe opening that door of awareness to see, has something happened? Have I been experiencing, or am I experiencing symptoms?
Right. And I think the other point that I'm taking from what you're saying right now that's really important to make is it doesn't really matter if you even identify it as, quote, trauma, as much as something's not right here, or, this thing happened to me and I don't feel right, or I'm not well, or, those are all signs that you need some help. We need to work
Right.
on it.
And that's really important to bring up, because we might not want to use that word traumatized. We might
Yeah.
not want to use that word sexual assault. But okay, well, let's look at it in a different way. How are things going for you? Is everything working out? Is everything not working out?
Mm-hmm.
And that might open up the discussion, which might need to happen.
Right, right. Great. Okay, so let's focus on maybe some of the ideas that you have for a trauma toolbox. Some ideas, we've talked about therapy and some of the things that might go on in therapy, but what are some of the things that other kind of ways to deal with and cope with trauma for ourselves or for our children that we can also implement that might be part of that toolbox that includes therapy?
I think again, if we're looking at someone who's maybe recognized that they've been traumatized, maybe they're in therapy right now, things that they can put into their toolbox is kind of gathering a support network. That might even be
Mm,
one person. Might be one person that they can talk to. That might be a therapist. That might be getting into a group. I'm supposed to have just as an aside, I'm supposed to have a hip replacement.
oh,
And I was like terrified to get this done for a specific reason. And I went on Facebook and I found this like support group. And it's just like amazing. There's so much help out there. So
I
just
love that.
reaching out
Mm-hmm.
to that kind of avenue to gain support, because once we realize that we're not the only one impacted, that just has so much healing impact for ourselves. That's
Mm-hmm.
one thing. The other thing is recognizing that it's not just your mind that's impacted, but your body, and
Mm-hmm.
understanding the importance of kind of jump-starting movement, the
Yes.
body in there, and doing that. And again, this sounds trite to say, but getting out there and getting active, getting exercise, that can be just walking. But within terms of healing trauma, that is crucial. That could be yoga. And again, depending on what type of trauma someone's experienced, right? If it's sexual assault, there might be issues or a certain level of uncomfortability about engaging the body.
Yeah.
That's important to recognize also.
Right. And I want
Uh,
to I want to jump in because you're talking my language here. You know, my new book is 8 Keys to Mental Health Through Exercise, and there is tons of research that shows how much being active, and you don't have to think of it as exercise, you know, with the capital E, but being moving your body, being active, getting out and doing something active helps your mind in so many ways. It can heal PTSD, anxiety, worry, stress. All these things that we're talking about can help with trauma in so many powerful ways. And the author who wrote the foreword to my book is Babette Rothschild, who wrote the book The Body Remembers. And I always think of that, you know, when you're talking about this, the body remembers what the mind forgets. You know, that is really what you're talking about. And it does get stored in our body. And so when we start to move our body in healthy ways and try to overcome some of the roadblocks and challenges that we face to moving our body or to being active, which is all what my book is about, but then we can free ourselves of all that stuff that's trapped in our body, not just our mind, it's both.
exactly. And I think that oftentimes is a big learning key or revelation for people.
Mm-hmm.
That just simple understanding of how, that the fact that trauma really impacts our body. They're like, wait a minute, I thought that it just was going to kind of screw me up in the head type thing. But
Especially if it's not a
um,
physical trauma, right? I mean, they think, oh,
exactly.
I just saw something terrible happen. How does that affect my body? But can you explain a little bit how does it affect our body?
Right. Well, what happens is that, in a very basic terms, oftentimes when we experience trauma, there's often again, it depends on what type of trauma, the sense of not being able to help ourselves, not being able to escape. I'm sure a lot of your listeners have heard of fight or flight. Oftentimes, when we're in a position like that, uh, the classic example is with the tiger. You know, this tiger kind of jumps out at us or is approaching us. If we're able to flee, we're oftentimes not being traumatized because we're able to kind of work through that experience in that moment. If we're not, if we have to fight, if we have to kind of submit or freeze, there's nowhere for that energy to go. There's nowhere for that incredible flood of hormones to go. And that goes into our body, goes into our body. The whole neurobiology of this is activated. And what happens when we become traumatized, those that neurobiology doesn't stop. We keep getting kind of triggered through our day. The hormones keep getting released, and we're wondering why we're kind of freaking out. We're wondering why we're acting in this certain way, where we're raging in this certain way.
Mm-hmm.
And therapy is in that beginning step to kind of allow that to open and unfold in a sense. And oftentimes we don't realize that.
Yeah. Yeah, no, I love how you explain that. That's really helpful. And I'm learning something new here too. I think it's really helpful for us to understand that when we can't get out of the situation, that energy has to go into our body. And that's where being active can help to start to move through that as you're mentally active in therapy and whatever else you're doing, physically being active as well. So let's add to that. So we've got in our toolbox, therapy and obviously recognizing we have a problem and finding hope, and also moving our body. What else would you add
I
to
would
that?
put the support network in there.
Support. Yes, that's right. I
Yeah,
forgot
yeah.
about that. That's
This
huge.
that is so huge, and
So
that can
huge.
be, maybe you could find a group. Maybe if you don't like that, you can find someone else
Yeah.
um, who's gone through something.
Yes.
And that is huge. Finding books or talks. There,
Mm-hmm.
with TED Talks,
Mm-hmm.
which is online. There are a lot of examples of people who've gone through experiences like this and have been able to work through them, who've been able to kind of begin their healing process. That is so profound and helpful for people, I think, too.
Yeah.
Listening to podcasts like this there are so many ways to do it.
Yeah.
If a podcast is not your thing, find a book, read a book, bibliotherapy.
Yeah.
of someone who's gone through a process like this.
Absolutely. And that's what my whole book, This Is How We Grow, is about. My own, how did I get through all that? And to me, I find it really helpful to read other people's stories and to hear them, like you're saying, in a talk or a podcast. So, and again, it reminds us that we're not alone, and that's really
Exactly.
important. Yeah.
I love that. I do that too.
Yeah.
Like I said, I'm still going through this hip thing and just
Oh
going
gosh.
online and seeing people just like me who are like dreading this,
Yes.
and you just make a post, I'm scared, and this like all these people just support you, and it's crazy, but it helps.
It's so funny because I
I
want to
don't know any of
connect
these.
you. I want to connect you with another friend of mine who just went through a hip replacement and
Oh,
she's
okay.
healing. But I'm thinking,
Definitely.
that's another way we help each other is as we talk to people that we trust, they can connect us. I've had several people who've inherited children like I did email me. And I used to think when it was happening to me, I thought, I wish I knew somebody who'd been through this to give me some kind of advice. And I do. I'm happy to email them back. And you said you get emails all the time because you understand, and you're happy to try to guide people to where they need to go. But,
Right.
that's another thing we can do is probably, help other people get support by connecting them with somebody who's been there if we know somebody or.
Right.
Mhm.
And knowing that you're not crazy.
That's a
That's
biggie.
really
Yeah.
important. I was talking to some guy literally a couple of days ago, and he had gone through a terrible experience, traumatic experience where he walked in and his friends had died.
Oh,
And
gosh.
this just really traumatized him. And this happened several years ago, and he was sitting there and he's like going through this process, and he knows what I do for a living. So he was saying to me, I'm not crazy, right? And
Mm-hmm.
I was listening to him and I said, "You're not nuts. You're
Mm-hmm.
not crazy. You've
Mm-hmm.
been traumatized." In our field, we often use this term of kind of a normal experience to an abnormal event, right?
Mm-hmm.
You're going through this normal process, i.e., these symptoms, to this very abnormal event, the trauma. And
Mm-hmm.
he just needed to hear that. And
Mm-hmm.
he said to me later on during the event, the day, he came up to me, thank you so much just for listening.
Yeah.
That's it.
Yeah.
And knowing that there are other people out there who have gone through this who can listen
Mm-hmm.
is huge.
Yeah, I think this is a great place for us to kind of wrap up is I think you're right. Knowing that you're not crazy. You can feel very crazy when you're experiencing a reaction to any kind of trauma, and to know that you're not alone, that you're not crazy, that you can heal, that there is hope. All these messages you're giving, they're so important for everybody out there listening.
Awesome. Yeah,
Yeah.
that's it. I couldn't
Well,
have said it better.
awesome. Yeah. Thank you so much, Guy McPherson, for being here. And again, everybody, you can go find him on his website at the traumatherapistproject.com. And also, they can download and listen to episodes of your podcast there as well, right?
Trauma therapist podcast, yeah, on iTunes as well. Yeah, definitely.
And on iTunes as well. Okay, awesome.
Yeah.
Well, we're grateful for you being here. And for everybody out there, I hope that you will take the things that you've heard today and apply them in your life and with your children and with your family and friends. And mostly, we just want you to leave with that message of hope that Guy was sharing all along and to know that you're not alone. So until next time, keep coming back here because this is a great place for support, as we know that we can grow through motherhood and we can do it here together each week on Motherhood Radio. I'll see you next time, everybody. Bye-bye.